Good morning. We've come here today to present a new and evidently beneficial method to treating stroke patients. This new method will allow many patients to survive the otherwise high mortality rate of a stroke by cutting the current treatment time from the recognition of a stroke to its treatment by a large fraction. But before we continue and reveal this method, it is beneficial to understand the causes and types of strokes and why this is such a crucial factor. Generally, a stroke is a brain attack that can happen in two ways. One, there is a clot or plaque that blocks the blood flow to certain parts of the brain. Or two, a blood vessel ruptures within the brain and causes blood to leak throughout it. If a stroke is caused by a clot in the brain, it's classified as an ischemic clot stroke. Blood clots are generally beneficial in a normal situation because they stop the bleeding when we get a cut, for example. But during a stroke, this clot cuts off parts of the brain and this causes cell death. The scary thing is that these clots can even occur in another part of your body, also known as an embolic clot, and they can travel to your brain to cause a stroke. Another cause of a clot is due to the buildup of plaque within the arteries, and just like rust in a pipe, it can accumulate enough to completely block off the blood flow to the brain. If a stroke is caused by a rupture of a blood vessel in the brain, it is classified as a hemorrhagic stroke. It should be noted that this is no less dangerous than the ischemic stroke, as the blood spreads through the body and stops the flow of oxygen and nutrients. This can be caused by an aneurysm, also a weak spot in the artery, which looks like a balloon. When it ruptures, or a tangle within the blood vessel, which is, imagine a knot, that eventually bursts due to the pressure. Unfortunately, a stroke can happen any time to anyone, so if possible, knowledge of stroke symptoms and prevention should be spread as much as possible. High blood pressure is a main risk factor for a stroke because there's more pressure on your blood vessels. There's a higher chance they'll burst. However, smoking, obesity, high cholesterol, diabetes, and previous stroke attacks are other risk factors that people should be wary of. So, you know the types of strokes and risk factors, but a crucial piece of information is identifying a stroke. In the occurrence of a stroke, the brain cells die rapidly. So, treatment must be started immediately or as soon as possible. Many patients fail to recognize a stroke, and even when they do, the treatment begins when they arrive at the hospital. The time delay between receiving the call for help and the start of treatment is all it will take to cause a fatality. The main method of identification is called FAST, F-A-S-T. These are key markers of someone undergoing a stroke. F, face. The face may have dropped on one side. A, arms. The person may not be able to lift one or both their arms. S, speech. Their speech may be slurred or garbled. And finally T, for time. If you suspect that you or someone else is having a stroke, call 000 immediately and ask for an ambulance. Now, onto the main topics of this talk. We believe that ambulance-based imaging for stroke patients is a viable innovation that can be used in today's society. Thrombolytic therapy is the ideal method of treatment for stroke patients. This is basically the administration of clot busters into the brain to dissolve these clots and resume blood flow. Recent developments in pre-hospital stroke management has revealed ways to a faster application of thrombolytic therapy. These innovations include the identification of stroke patients by dispatchers or paramedics, installation of modern diagnostics such as point-of-care laboratories, duplex sonography, and brain CT scanners in ambulances. The reason why this is such a big deal is linked to the nature and progression of a stroke. As you now know, following a stroke, the brain cells start to die off rapidly, proving time to be such a crucial factor in the treatment of the patient. The research has been found and has very strong evidence between the time taken to treat the patient and irreversible tissue damage. So, the faster we are able to treat and diagnose the patient, the less permanent damage is inflicted. The solution to this lies within the idea of pre-hospital diagnosis, where the time taken from the initial alarm of a stroke to the diagnosis and treatment may be drastically lowered. Normally, the patient must lie idle as they make their way to the hospital, and during this time, the conditions worsen and will result in more permanent damage. However, with the inclusion of a CT scanner inside the ambulance, diagnosis and treatment may begin during the ride to the hospital. This allows the immediate diagnosis and reduction in overall time, and overall, this idea is capable of preventing unnecessary deaths and disabilities where time plays an important role. What we have found is that there has been a study based on this idea of having a pre-hospital diagnosis in the form of what we mentioned earlier, having ambulance-based techniques and machinery. This research was done by Ebing et al., and they focused on the effect of the use of ambulance-based thrombolysis on time to thrombolysis in acute ischemic stroke. The study was conducted in Berlin, Germany, using a stroke emergency mobile, also known as a STEMO. The STEMO is equipped with a CT scanner, point-of-care laboratory, and telemedicine connection, stroke identification algorithm at dispatcher levels, and a pre-hospital stroke team. The point-of-care laboratory on board offers tests that covers blood count, electrolyte count, creatinine count, and glucose count, all within the blood. Thrombolysis would begin before transport to the hospital if an ischemic stroke was detected and confirmed. What was recorded was the alarm to thrombolysis time, the time taken between receiving the call and starting treatment of the stroke. On board the STEMO are a neurologist, a paramedic, and a radiology technician. Upon arrival, the neurologist and paramedic would work to confirm that the patient was suffering from a stroke and immediately begin treatment. At a minimum, the complete blood cell count and blood glucose levels was to be determined after undergoing CT scans. The on-the-scene paramedics would then begin thrombolysis treatment via intravenous tissue plasminogen activator, which is basically a protein which breaks down the blood clots. During the 21-month study from May 2011 to January 2013, the stroke dispatch was activated a total of 7,098 times. During STEMO weeks, in which the STEMO vehicle was deployed, there were 22,027 patients in which the STEMO had recovered, and 1,641 without. 1,804 of the patients with the STEMO deployment had in-hospital documentations. Some were excluded because they were not transported by the STEMO and did not have matching data with the hospital or died before arrival. During the control weeks, there was a total of 3,430 total deployments, of which 2,969 of the total had in-hospital documentation. In comparison to the control week, the STEMO weeks had a mean alarm to treatment time of just 15 minutes, whereas the control had 25 minutes, a difference of 10 total minutes. The times from alarm to blood counts and imaging treatments were all shorter during the STEMO weeks, and after STEMO deployment and during the control weeks. The time difference is only accountable due to the fact that treatment was started prior to transportation, which is only available in the STEMO vehicles, with speedy clinical examinations, to preventing double assessments and time-consuming handovers. The pros of this method are pretty obvious, and statistically backed in the study in Berlin. You can diagnose the patient almost immediately after boarding the ambulance, and that leads to treatment immediately, lowering the mortality rate due to stroke and the degree of permanent damage. Even if treatment cannot begin on the ambulance, the diagnosis using the medical imaging devices on board allows the patient to be treated immediately upon arrival, which saves so much time that's wasted as the patient is received by the hospital and diagnosed. However, as there's pros, there must be cons. Despite all these positive results, there are difficulties that arise with its use. These problems lie mainly with hardware and cost restrictions. Normal ambulances are already restricted in terms of space, where everything's tight and cozy, and medical imaging devices aren't really the smallest things either. So, technology this doesn't really work out. meaning not all ambulances are able to be equipped with this latest technology. This will mean there will be massive costs. I mean, a CT scanner really isn't cheap, nor is an ambulance. Accompanying the modification of existing ambulances to facilitate this medical imaging device, or just the ambulances that are pre-equipped with these devices. A single steamer vehicle from the study before totaled up to 1.4 million USD dollars, and that's just one. The cost would skyrocket for multiple vehicles across the country. Furthermore, there would be training costs as well to consider, which raise the technicians and drivers capable of handling such hardware. This is just as crucial as they play a pivotal role in treating the patients too. The CT scan must be conducted accurately, and the movement in the vehicle can disrupt this. If a diagnostic CT scan can't be acquired in the ambulance, the treatment will have to wait until they arrive at the hospital. And if they drive slower to accommodate for this patient, arrival at the hospital will be a slower time too. Overall, we believe that the use of ambulance-based imaging to treat stroke patients is an advantage to have, such as it is capable of saving lives. The early diagnosis helps not only the doctors in reducing delays, but also other patients at the hospital, as the waiting time is reduced between patients and availability of doctors. As stroke patients require immediate aid to allow blood flow to the brain, this procedure will be greatly beneficial. Thank you.